Hello, and welcome to another live broadcast with MedStar Health. My name is Amy Cameron. October is Liver Health Awareness Month. Nearly 100 million people in the U.S. have some form of liver disease. Many of them are undiagnosed and are at risk for liver failure. Liver disease can affect children. Without a good diagnosis and treatment plan, your liver can fail, which leads to life-threatening medical problems. Today, we're joined by our team of experts, MedStar Health gastroenterologist Dr. Disha Sharma, transplant certified registered nurse practitioner Lori Oros, and transplant hepatologist Dr. Filipia Ligero, and Dr. Rohit Satoskar, I'm so sorry, from the MedStar Georgetown Transplant Institute. We're here today to learn about how the liver functions, ways to keep it healthy, and what to do when your liver is at risk. Make sure to give us a like to let us know you're watching, and if you have any questions for our experts, you can leave those in the comments below. Now, let's meet our panel of experts. Thank you all so much for joining us today. Could you please tell our audience a little bit about yourself and the work you do here at MedStar Health? Let's start with Dr. Sharma.
Hi, everyone. I'm glad to be here. I'm a general gastroenterologist and hepatologist in Baltimore region. I see patients at MedStar Harbor Hospital, Franklin Square Hospital, as well as the Federal Hill MedStar Clinic.
Awesome. Thank you so much. Lori, could you introduce yourself next?
Yes, I'm Lori Orris. I'm a nurse practitioner that works in transplant hepatology with MedStar Georgetown Transplant Institute at Franklin Square. And in conjunction with Dr. Ligero, we see patients that have any kind of liver abnormalities or disease at the hospital at Franklin Square. And I also follow post-transplant patients in our clinic.
Awesome. Thank you. Dr. Ligero, could you go next?
Hi, my name is Felipa Ligero. I'm a transplant hepatologist, which is a medical doctor who follows patients with liver disease anywhere from having just mild liver abnormalities through the transplant process and even after transplant. I'm located primarily here in the Baltimore area at Franklin Square.
Thank you. And Dr. Satoskar.
Good afternoon. Thank you for having us. I'm Rohit Satoskar. I am a transplant hepatologist, just like Dr. Ligero. So I care for patients with liver disease, patients that may need liver transplant, as well as patients that have had liver transplant. I'm also the director of medical services for the MedStar Georgetown Transplant Institute.
Amazing. Thank you all so much. Let's get started with some questions and understand some of the basics. Dr. Sharma, where is the liver in our body and what is its function?
So liver is a very important organ. It's the second largest organ after skin in your body, and it sits right on the right side on your upper belly. It has many functions. The important ones are it can help digest your food, including the sugars, the fats, the proteins, and in times when you're not eating, especially when you're sleeping at night, it stores these sugars, this glycogen in your liver, and maintains sugar levels. It also does the function of detoxifying a lot of harmful chemicals, including drugs, alcohol, and make sure that our body is not affected by these chemicals. And then it helps create proteins that are involved in clotting and maintaining the fluid in our blood.
Okay. What happens when our liver isn't functioning properly?
So a lot of these functions stop happening. You start building toxic chemicals like ammonia in your body. You can get confused. You can even go into a coma. You lose the ability to clot blood. So a lot of patients will bleed from various parts in their bodies. And then you're at risk of infections. You will start building up fluid in your belly and all of your body if your liver is not functioning properly. Okay. Another one to mention is your eyes and your skin can become yellow, because liver is also involved in how your bile is metabolized.
Oh, wow. Who is at risk for liver disease?
A lot of liver disease, especially early on, is silent. And it's important to understand who's at risk because we have to catch it early. That's important because a lot of the signs that I spoke about earlier don't show up in people till they are at end stage of liver disease. So 3 important groups of people who are at risk of liver disease are people who have heavy alcohol use. So an upper limit of safety of drinking alcohol is 2 drinks a day for men, which is 14 drinks of alcohol in a week, and 1 drink a day for women, so 7 drinks per week. And any more intake than that can put you at risk of long-term liver disease.
Mm-hmm.
There are patients who have diabetes, obesity, high lipid and cholesterol. Those patients are at risk of depositing fat in your liver, and that can cause inflammation and liver disease as well. We are seeing this much more commonly now. And another large group of patients who are at risk of liver disease are people who are exposed to viral hepatitis, like hepatitis A, B, C, D, and E. A spreads through contaminated food and water, visiting endemic areas like the South and Central America, Asia. B can spread through from mom to the children, um, exposure to body fluids, sexual contact, exchanging needles in people who do IV drugs. Um, that can put you at risk of viral hepatitis, especially B.
What's the most common liver condition? Is it hepatitis, like you just mentioned, or is there another one?
It's been hepatitis for many years, but during the pandemic we saw alcohol associated liver disease on the rise, and then more frequently with the obesity epidemic we are seeing MASLD, or this fatty liver disease, much more commonly now.
Oh, wow.
Amy, the only other thing I would add, I agree with everything Dr. Sharma said, but we are seeing, you know, a rise in liver disease from fat deposition in the liver, and we're seeing that worldwide. We think at this point, up to 1 in 3 Americans can be affected by this.
Wow.
So that's pretty common if you think about it,
Mhm.
and it very closely, you know, mirrors some of the increases we're seeing in diabetes and obesity. So that's really one of the more common liver diseases we're seeing sort of every day in our clinics.
Oh, wow. Very interesting. Lori, what are some other serious liver conditions? Oh, you're on mute, Lori. Oh,
Sorry about that.
that's okay.
Now I'll try that again. So autoimmune disorders can affect the liver, such as autoimmune hepatitis, where the body kind of attacks itself for unknown reasons. And then there's also primary biliary cirrhosis or cholangitis, and also primary sclerosing cholangitis. And these diseases can, you know, affect the liver. And again, these can kind of, to Dr. Sharma's point, they can kind of be silent until patients start to develop symptoms and the disease process is quite underway by that point. Also, another serious liver condition could be primary liver cancer, known as hepatocellular carcinoma. And patients are at risk if they have underlying liver disease for that.
Oh,
And
okay. How
you
are
know, Amy, as sort of, you know, was mentioned by both Lori and Dr. Sharma, you know, the liver, as we mentioned, plays such a vital role in the body and has so many critical functions. Many of these different liver diseases that were mentioned can be silent initially, maybe just be picked up on laboratory tests. And you know, early on in the disease, when patients don't have symptoms, there can be ongoing inflammation from those diseases, and it's important to pick them up early so we can potentially treat them. Because any disease process that causes chronic inflammation in the liver, if you let it go too long without treatment, that's when we start to see some of the serious complications, which we'll probably get into a little bit later. But it's that really that sort of long-term inflammation in the liver from whatever cause, whether it's fat, alcohol, a virus, autoimmune condition. It's that long-term can lead to more problems.
so you mentioned fatty liver disease. I'm just curious, how does that accumulate? Like, how does fat accumulate in the liver?
Um, so fat in the liver can accumulate in similar ways to fat accumulating elsewhere in the body.
Okay.
So it's really related to what we would call metabolic risk factors. One of the primary ones is diabetes, pre-diabetes, or what's termed insulin resistance, which
Hmm.
has to do with how your body, processes sugars and carbohydrates. But because of people that have, some of those underlying risk factors, your body can deposit fat in the liver, much like it can in other places.
Oh, wow. Okay. Thank you. How are some of these serious liver conditions diagnosed?
Sometimes it's just incidental that you come to the hospital for some other problem and they do maybe a CAT scan or an ultrasound and they notice that the liver appears abnormal. Or it could just be through routine checkups at your primary care provider's office where they see that you have abnormal liver enzymes or your bilirubin's a little bit elevated or or your platelets are low. There's different things in your blood work that gets done on a routine basis for other reasons. Or, then as you're working that up, if your primary care finds that you have abnormal liver function tests, then they may do imaging, specifically looking at the liver. As I mentioned, ultrasound, CAT scan, or an MRI would be the ways that you could be diagnosed.
So you mentioned that some of these are like silent and you don't always have symptoms. So by the time you have symptoms, is it usually pretty advanced?
Sometimes it depends on what the cause is. If sometimes we've actually seen a little bit of an increase over the past couple of years of people taking a lot of natural and herbal supplements.
Mm.
And so sometimes they've had normal liver numbers in the past, but then all of a sudden they present because they developed yellow skin, yellow eyes, or very dark urine. And so that brings them to the hospital. And then we kind of, notice that their liver enzymes are very elevated. And so you can get what's called drug-induced liver injury related to some herbal supplements. So we caution people when taking herbal supplements.
I actually saw a news story recently. A woman was taking turmeric
Yeah.
and ended up with like
Yes, that's
liver
been one
problems.
that we've seen
That's
multiple
so
times,
interesting.
actually, unfortunately. And it's
Wow.
something that I think once, people take it a lot of times for anti-inflammatory to treat arthritis. They think they're doing something better than taking pain pills or trying
Exactly.
to treat it naturally. And inadvertently, it ends up that the liver develops a toxicity to the liver. And so the way we treat that is just letting time and monitoring of the liver numbers and kind of supporting them through that and avoiding that in the future. And most of those kind of drug-induced liver injuries do improve on their own that way.
Well, that's good. How can some of those other liver diseases be prevented?
Um, so as we talked about the metabolic risk factors, so things that are generally for your good health and heart healthy are controlling your blood pressure, controlling your blood sugar, controlling your weight, staying active and not being sedentary. If you have a sedentary type of work, then making sure that that you're active during the times you're not working. Regular exercise and eating a healthy diet.
Okay. And Dr. Satoskar, you had talked about fatty liver disease and how it can be caused by insulin resistance. Are you guys seeing a drop in that because of like the increase in people on GLP-1s?
Yeah, it's a good question. So I don't know that we've seen a drop in it across the board yet, due to GLP-1 agonists. But bringing up the GLP-1 agonists sort of lends itself to another, I think, topic which we kind of touched on a little bit is some of the treatments, for patients with liver disease. And so specifically when we're talking about, fatty liver. There are treatments available. The mainstay of treatment is to really manage the underlying metabolic risk factors. And so it's to attempt to lose weight, to exercise. There's probably an independent benefit of exercise in addition to losing weight. But we now have medical therapies too that are available. And recently, there's been data showing that some of the GLP-1 agonists can be very effective in helping people with certain stages of fatty liver disease. In other types of liver disease, we've actually made remarkable progress over the course of my career in terms of treatment. So, when I started in hepatology, we had very suboptimal treatments for hepatitis C, for example.
Mm.
They were very difficult to tolerate, and people did not respond well to them. So many patients would go on to transplant as a result of hepatitis C. Now we have treatments that are, nearly 100% effective that are oral to cure hepatitis C.
Oh, amazing.
We have treatments for hepatitis B, which we still can't cure hepatitis B, but we can suppress it effectively
Hmm.
and prevent people from developing, progressive liver disease. So there are a lot of treatments available. The key is finding the disease and then getting people on appropriate treatment early.
Okay. Dr. Legiro, when would a patient be referred to the liver evaluation clinic at MedStar Franklin Square Medical Center?
Yeah, really, any patients who have any sort of liver dysfunction can be referred to our clinic. Whether those are patients who were just, kind of incidentally found to have abnormal liver tests on blood work that were done by their primary care. Maybe they were found to have hepatitis B, hepatitis C. If there's any sort of abnormality that's detected on labs, sometimes, as people have mentioned, people will get, you'll get a scan for some reason and they see something abnormal. Anybody can be referred to our clinic. Other times, patients who are referred already have what we call established cirrhosis. So these chronic conditions have gone on long enough that they've developed cirrhosis, which is basically a kind of end stage scarring to the liver that can come with various complications. So really, at the end of the day, anyone who has liver disease can be referred to our clinic. At times, these are patients that will follow chronically over time and kind of monitor them over the course of their disease process. Other times, if it's something like maybe they were taking a supplement and then maybe the numbers go up and they've stopped it and now things have gone back to normal, it can be the sort of thing where they follow for a brief period of time.
Okay. When would you recommend a liver transplant?
So a liver transplant, just to give a little bit more background about kind of what that is, a liver transplant is where basically you remove someone's liver that isn't working appropriately and you replace it with another liver. Most commonly in the United States, that's through a deceased donation. So someone who's passed away and is an organ donor, you can have their liver transplanted. A liver transplant is recommended when someone generally has established cirrhosis, so they have that end stage scarring to the liver that has developed as a result of some other process. As far as we've come in medicine thus far, we have ways to cure hepatitis C, treat hepatitis B, newer medicines every day to help manage fatty liver. We haven't been able to find a way to get rid of the scar tissue that sets it. We haven't been able to find a way to get rid of the cirrhosis. So once you have cirrhosis and you've started developing complications related to that, so what does that mean? That means, so sometimes once that scar tissue sets in, the liver has trouble doing its job. So sometimes people become very jaundiced. Their eyes turn yellow, their skin turns yellow. Sometimes, as Dr. Sharma had mentioned, the liver can't detoxify toxins and they have problems with confusion that require medications, something we call encephalopathy. Other times, because of that scarred liver, blood is trying to get through normally, but it can't. It backs up. They can end up with fluid in their abdomen, something we call ascites. They can end up with enlarged blood vessels in their esophagus, which is the tube that connects their mouth to the stomach, because the blood is trying to go somewhere and it goes to places, they kind of goes backwards. And those varices in the esophagus, those enlarged blood vessels, can rupture and bleed. Other times, people can develop cancer in the liver. Having cirrhosis of the liver is an independent risk factor for developing liver cancer. So I tell people, in the same way that a woman having breast, a male having prostate can put you at risk of breast cancer, prostate cancer, having cirrhosis by itself puts you at risk of liver cancer. So once you've started developing those complications, that would be the time to start thinking about whether or not a referral for a liver transplant would be appropriate.
Okay. And then what's the next step? Then do they go to MedStar Georgetown Transplant Institute if they were to be referred for a transplant?
Yeah, so in MedStar, the physical surgeries are done at Georgetown. So if you get referred for a liver transplant and you get put on the list, then the actual physical surgery would be done at Georgetown. But the actual evaluation process can be done here at Franklin Square. I'm here physically, Lori is here. We also have a coordinator that helps manage. But the actual evaluation would be done here at Franklin Square. We would follow you throughout the process of the evaluation here. The physical surgery would be done at Georgetown. And then generally speaking, I'd say on average, it's reasonable to expect that you'd have to go down to DC for about 2 to 3 months. And then after that, you'd come back to up here to Franklin Square, and we would follow you here for the remainder. So for our Baltimore patients, we can do most of their care here at Franklin Square.
Oh, that's nice. That's very convenient.
Mhm.
I will pause, and we do have one question from our audience. Are there foods I can eat that will lessen a fatty liver that is not from alcohol? I think we know that fatty liver doesn't come from alcohol, correct?
So you can get, so fatty liver is kind of what it sounds like. There's fat in the liver. The
Mhm.
two most common ways you get fat in the liver is through alcohol. That's actually
Oh, okay.
how alcohol causes damage, is when it gets broken down, it gets deposited as fat in the liver. And then as Dr. Satoskar said, you can get fat in the liver in the same way we can get fat anywhere else. To my knowledge, there's not like a specific food that is going to be better than others. There's not a food you can eat that will miraculously make it go away. There's not a specific food that's necessarily going to make it worse. It's really about finding balance and having a well-balanced, healthy diet.
Yeah, I think that's absolutely true. Yeah, so there's not a specific food we would recommend, but probably the most data around appropriate diet for patients that have fat deposition in the liver. The most data supports, what's referred to as the Mediterranean diet,
Mhm.
which is avoiding ultra processed foods, a diet that's very high, in plant matter and vegetables and limited lean meats. So that's what we would generally recommend for people.
Okay, that's helpful. And then, okay, switching gears to Dr. Satoskar, what are the most common reasons that a patient would need a liver transplant?
Yeah, so as Dr. Leggero mentioned, probably the most common reason is what we would call decompensated cirrhosis. So this is someone that has developed chronic liver disease. They've developed that end stage of scarring in the liver or cirrhosis, and then they go on to develop complications from that. And some of those complications may be jaundice, confusion, fluid retention, bleeding. Those are hallmarks of what we call decompensation. And we know that those patients benefit from liver transplant because, unfortunately, without a transplant, their risk of death is high. So that's probably the most common reason why we do transplant. Now, the underlying etiology or the underlying cause of the cirrhosis could be any of the things we've talked about,
Mhm.
right? So many of the things that Lori mentioned, but it's that end stage cirrhosis that's the most common cause. Now, there are some other more acute causes where someone doesn't have chronic liver disease and they need to undergo an emergent or urgent liver transplant. We can sometimes see that from toxicity from certain drugs, from acetaminophen. Taking too much acetaminophen can also lead to that. Liver cancer is also another indication for liver transplantation. So a large number of liver transplants are done for primary liver cancer or hepatocellular carcinoma. And then, the other thing which we are doing at MedStar Georgetown Transplant Institute is transplants for other types of cancer indications.
Mm.
So historically, the primary liver cancer was the main indication from a cancer perspective. We are now doing liver transplants for patients that may have certain types of bile duct cancers as well as metastatic colorectal cancer
Mm.
in specific cases. So the indications for transplant and the people that can benefit from transplant is growing. And so we do have those options available for
Oh,
patients.
that's great. How does the liver transplant team work together?
So liver transplant is inherently multidisciplinary. So we have a large team at MGTI. We have multiple medical professionals that would be engaged in your care, and that includes a hepatologist like myself or Dr. Leggero, a transplant surgeon who would actually do the surgery. You would have a nurse coordinator who would sort of be with you every step along the way to act as a liaison, but to also help answer any questions you have throughout the process. A dietitian is involved, a social worker is involved, a financial coordinator. So if you begin to go through the liver transplant process, you really have a whole team that is behind you, sort of hoping to assure success.
That's amazing. Why should a patient choose to have their care at the MedStar Georgetown Transplant Institute?
So, I think when one of the things that was mentioned earlier was getting into care early is important. So that's one thing. Finding the right care is important too. And when finding the right care, I think there's a couple things. One, I think you want to go somewhere where there's experience
Mm.
and there's a track record. We have combined many decades of experience amongst our team. We've grown a lot over time, so I think we do have the experience. Um, the other thing I think that's important is you want to go somewhere where you feel like you're connecting with your care team. So that relationship with the care team is really important for patients. And I think that's something we've really strived to try to do well, is to really be patient focused and really focus on that individual patient in front of us and think about, what's right for them and how does, the treatment plan that we're recommending, fit in with their values. So I think that's the other piece, to find a care team that you feel like you really connect with and can trust.
That's awesome. Before we close out, I like to ask a question of the panel. What's one question that patients should ask their doctor if they have some of the symptoms that we've discussed today? So where would they start?
I think seeing your primary care physician is the most important thing. That's where we pick up early liver disease. If you have the risk factors and you recognize the risk factors for liver disease, you should go to your primary care physician. They can run simple tests and then get referred to a hepatologist or a general gastroenterologist for early liver disease. And beyond that, if you have complex liver disease, you should be seeing a hepatologist regularly and be in their care long term. So the first thing is to get tested and to get recognized.
That's perfect. Did anyone else have anything to add to that?
I think just to get engaged in your care. We are seeing patients more and more engaged in their care and advocating for themselves. So, they should continue to do that, be engaged, talk to your care team, ask questions, make sure you let them know what's happening in your life. I think that's something that patients should strive for.
That's great advice. Okay, and last question. What's one piece of advice you'd give to someone who's newly diagnosed with liver disease and feeling overwhelmed? Dr. Sharma or Lori, go ahead and start.
I was just going to say, I think to avoid getting overwhelmed, just kind of take it piece by piece, one step at a time. I think that we're pretty good at trying to give the big picture versus the now picture, so that to help patients kind of focus on what needs to be done initially, and letting them know that it gets better. And if it because of their own situation, it's not getting better, that they're not alone, that we're there with them every step of the way.
That's amazing.
Other thing I'll mention is, there are patient support groups available. too. So, beyond sort of engaging with your care team and getting the support there are patient groups available. We do have patient support groups available through the Transplant Institute too, where people can come together and share some of their stories and get support from others. And there are several other organizations, at the national level that also exist that provide that type of thing.
Oh, that's nice.
And gone are the days where if you're diagnosed, you don't have treatment. We have good treatment coming up for all kinds of liver diseases. So catching it early and getting treatment can prevent you from getting to end-stage liver disease. That's really important to remember.
Mhm. Great advice. And Dr. Legiro, did you have anything to add?
No, I think that pretty much kind of sums it up. I think a lot of times it can be overwhelming when you hear that there might be something wrong with, as we talked about, the second biggest organ in your body, right? People hear the liver and they're like, oh no. And I think one important thing to keep in mind, and I see this a lot, is that, there's a lot of information out there and you hear a lot of things and different people experiences. And just, sometimes it's important to just kind of, see your doctor, talk to them about it, and explain what's going on. Let them kind of help guide you through. A lot of times, there are a lot of things we can do. It's not maybe as bad as you might think, and just, be open and kind of talk to us and let us know so that we can also help, calm any sort of anxieties you might have that we're not even aware of. I find that sometimes where people will be like, oh, I'm so glad, you explained this because I was afraid of X, Y, and Z. And I was like, oh gosh, if I had known that, I would have told you from the beginning. So I think it's just being, open with your care team, and not allowing yourself to get too overwhelmed. And just if you have questions, ask us. That's what we're here for. And we're always happy to answer them.
That's amazing. Well, that's all we have for today. Thank you so much to our viewers for tuning in, and thank you to our panel of experts for joining us today. This has been valuable information. For a referral to a gastroenterologist, call 443-782-7640. If you'd like more information about the liver transplant program at MedStar Georgetown Transplant Institute, visit medstarhealth.org/transplant or call 202-444-3700. And we'll have all of this information in the comments. Thank you again for joining us. Have a great day.
Thank you.
Thank you.